So my name is Scott. I'm 63 years old, and the past 2 or 3 years, I've just been having a lot of trouble with my knee. It's been almost bone on bone, and where I'm losing sleep, and just really uncomfortable. I decided finally it was time to get a full knee replacement through the assistance of the staff at OrthoVirginia, and educating me on the process and the procedure and what I can expect. I ended up having it done on April 10th of this year with Dr. Alamanda. And I had seen his video on YouTube explaining the details of the Mako robotic procedure, which really sold me on the idea of having my knee replaced with OrthoVirginia, with Dr. Alamanda, using that Mako procedure. And so one of the things that I like to do is I like to ride my bike, whatever the weather permitting, during the late spring or to early fall. And after having surgery at the Franklin Farms Surgical Center, which is where I'm very close to right now, and then attending the physical therapy at the Fair Oaks Physical Therapy location, and shout out to Jean Wang, who was my physical therapist for that. I told Jean that I was really looking forward to getting back on my bike, and she told me what I needed to focus on in order to do that. And so I guess about 4 or 5 weeks after the surgery, I started really focusing on the recumbent bike that I've got access to in the gym, the building where I live in Fair Lakes. And I started really working out on the gym in the recumbent bike and trying to get my right knee to where I can do full 360-degree rotations, and just trying to get back on my bike. About week 7 of recovery, I was able to put some real time on the recumbent bike machine, anywhere between 20 minutes, 25 minutes. And around week 8, I felt confident enough to try to get on my bike and take it for a short ride to see how I do. So I finally had the nerve to get up on my bike, and I as soon as I did get on it, I realized my knee was a little tight, so I raised the seat an inch, and then I had to raise my seat another inch. But once I got the seat high enough to where I felt more comfortable, I started going for my normal ride. And I wanted to take a break and stop halfway. And so I stopped at the Starbucks, which happens to be right across the street from the Franklin Farms Surgical Center, where I had my full knee replaced by Dr. Alamanda on April 10th. And so here I am, just 2 days shy of 8 weeks. And I managed to ride my bike all the way up to Franklin Farms. The goal was to get a picture, like a selfie of myself with my bike in the background in front of the Franklin Farms Surgical Center, so that I could show off to Dr. Alamanda. And by the way, shout out to the folks at Franklin Farms Surgical Center. They're fantastic. Pre-op, they were fantastic to me. Post-op, they were fantastic to me. Everything that happened after the post-op, I was completely expected, because they told me exactly what to expect. And so those folks are fantastic too. Then I have another story to tell from 2015, when Dr. Ron Childs, also with OrthoVirginia, fused my L4, L5, and S1. The whole goal after that surgery and recovery for that surgery was to get back into my scuba diving habit. So I actually had a picture of myself on a liveaboard dive boat in Thailand 10 months after having my L4, L5, S1 fused. I'm kind of a frequent flyer at OrthoVirginia, and they're fantastic folks. I can't say enough good things about them. And so that's the story behind the picture of me in front of the Franklin Farms Surgical Center 8 weeks post-op, and the story of me on a liveaboard dive boat in Thailand 10 months after my back fusion surgery by Dr. Ron Childs.